This on-demand tutorial will be walking you through the 6 key principles of the CANS as found at the Parade Foundation website. The first principle we'll look at is that the items were selected because they are each relevant to a service or treatment planning. An item exists because it might lead you down a different pathway in terms of planning actions. The second principle we'll look at is that each item uses a 4-level rating system that translates into action. Different action levels exist for needs and strengths. When looking at the needs, we see that 2s and 3s are actionable needs, and these are the items that we will leave notes on if they're scored such. For strengths, 0s and 1s are the usable strengths that we'll be using. And in those cases, we'll be leaving notes for those 0s and 1s explaining why those items might be a strength for the child. The third principle is that culture and development should be considered prior to establishing an action level. Cultural sensitivity involves considering whether cultural factors are influencing the expression of needs and strengths. Rating should be completed considering the youth or child's developmental and/or chronic age depending on the item. Keep in mind that culture can refer to many different aspects. The fourth principle is that the ratings are generally agnostic as to the etiology. In other words, this is a descriptive tool. It is almost always about the what and not the why. If we look at item number 39, sleep, we can see an example of this what and not the why. 39, sleep, says that this item rates any disruptions in sleep, regardless of the cause, including problems with going to sleep, staying asleep, waking up early, or sleeping too much. This item is not looking at why the child or youth might not be sleeping, but rather what is happening. Their sleep is being disrupted. While most items are purely descriptive, there are a few items that consider cause and effect. Item 101, nutritional management, is one of these items that considers the why. If we look at the description, it says this item refers to the caregiver or parent's ability to understand their child's nutritional needs and provide a reasonable, healthy diet. A 0, the caregiver is able to plan and produce a healthy diet for the child. A 1, the caregiver is able to plan a healthy diet but may struggle with providing it consistently. A 2, the parent or caregiver is unable to provide a consistent diet for the child. The caregiver is not knowledgeable about nutritional needs for the child. In this case, they might not be able to because financial constraints, or they maybe just don't want to or don't have the knowledge to. And a 3, the parent or caregiver is not able to or not willing to provide healthy nutritional management for the child. In this case, it is also about not being able to or not wanting to. So here we see the why and not the what. 112, job functioning, is another example that considers the why. If we look at the description, it says this item is rating only for individuals who are employed or in employment-like environments. An individual whose disability prevents employment would be rated a 0. If we jump down to the actionable levels of this item, we see that it says a parent or caregiver is having significant work-related problems or is temporarily unemployed because of such difficulties. And a 3, significant difficulties with vocational functioning. Parent or caregiver is chronically unemployed or obtains financial resources through activities that are illegal and or potentially harmful to themselves and their family members. So here in this example, we see that there is a why. They are having difficulty functioning within their job, and why are they having that difficulty? The fifth key principle is that ratings should describe the child or youth, not the child or youth in services. If an intervention is present that is masking a need but must stay in place, this should be factored into the rating consideration and would result in a rating of an actionable need. Item number 50, depression, is an example of this. It would still be rated actionable if a youth is taking medication that is reducing the depression. In this case, we see that depression has decreased due to medication. This item should be scored actionable because once the medication is stopped, the depression will resume. This is true also for attention deficit, anxiety, psychosis, recreation, school behavior, etc. The sixth key principle is that a 30-day window is used for ratings to make sure assessments stay relevant to the child or youth's present circumstances. However, the action levels can be used to override the 30-day rating period. Number 61, suicide risk, is an example of this. Here we see some clear indications of when we should be scoring this item. A history of suicidal or self-injurious behavior is a 1. A recency, last 30 days but not acute today suicidal ideations or self-injurious in the past 30 days. And a 3, current suicidal ideations or intent in the past 24 hours. However, if you are working with a youth and you feel that this might meet the description of a 1, but feel that it should really be a 2 and there should be an action put in place, go ahead and score that item a 2 and make sure to leave a note that justifies why you gave it an action level of a 2. To practice one of these items, let's look at this vignette. A 15-year-old told you that he has struggled with suicidal thoughts for over a year now. There is a documented history of cutting, self-harm, on his legs as recently as 3 months ago. He attempted suicide just over 2 months ago. He began therapy with an adolescent therapist who specializes in trauma treatment 4 weeks ago. He reported to you that he had just found out yesterday that his father relapsed and was arrested for DUI. Based on all of the information that we have here, how would you rate number 61, suicide risk? Consider the level of intervention or action that is needed. In this case, our preferred score was a 2. Despite the exact language of the CANS qualifying the score of a 1, we are going to use the action level or intervention level to override to score this item a 2. This youth needs ongoing actionable intervention. Suicide risk will be rated at its highest level outside of the frequency window if preventative services have been put in place. In this case, the action level may be more important to capture than the time frame of the behavior. In this case, it is especially important to leave notes that justify the action level.